In this video, I'm going to show you the 5 best exercises to target the Gluteus Maximus. Hi and welcome back to Physiotutors. The Gluteus Maximus is a powerful hip extensor and lateral rotator and our most important muscle when we try to accelerate our body upward and forward from around 45 to 60 degrees of hip flexion. On top of that, it plays an important role in plant and cut maneuvers to the opposite side. Hip dysfunction is one factor that has been associated with low back and various lower extremity pathologies, and there's a strong association between lateral rotation weakness and patellofemoral pain syndrome. When designing a strengthening or rehab program for patients, there are multiple factors that play a role in the exercise selection. One of those factors is the degree of muscle activation that can be achieved by a certain exercise and measured by EMG. Reimann et al. Did a systematic review in the year 2012 and evaluated the activation of the Gluteus Maximus in several exercises. Here are the top 5 with the highest activation from low to high. Have your patient stand in front of a stepper. Then the patient has to step back onto the stepper with the side to be trained and pushes himself up with the leg placed on the stepper. Common mistakes are pushing up with the leg on the floor and dropping of the pelvis. This is a great version of the single leg squat that recruits the glute medius to a high degree as well and prevents the patients from falling into valgus position on a stance leg. So it can be a great exercise to build up to the free one-leg squat. To do this exercise, have your patient position his trunk and hip flexed to 90 degrees against the wall with the stance limb 15 centimeters away from the wall. By having your patients press into the wall the whole time, they will have to recruit their gluteus medius on the stance leg maximally. Then ask your patients to lower themselves into a squat position and push up again. This is another great functional exercise that targets almost all muscles of the lower leg and has high coordinative demands. Have your patient stand on a stepper and have them touch the floor with the heel of the free leg. You can progress this exercise by increasing the stepper height and regress it by having them sit and get up from a cube. In this exercise, the glute maximus has to work eccentrically and concentrically, while the gluteus medius has to work isometrically to a high degree as well in a standing leg. It's a great exercise to improve coordination and balance, while the hamstrings are loaded eccentrically as well during the lowering phase. Have your patient slightly bend the standing leg and extend the knee of the free leg. Then ask your patient to flex the hip of the standing leg while you keep a straight back. Be careful that your patient's toes of the free leg point to the floor to prevent too much rotation at the hip. The patient can also put his hands on the pelvis to have visual input and to correct rotation of the hip and trunk. To progress this exercise, you can use a barbell or have your patient hold on to a weight. This exercise had the highest EMG activity of the gluteus maximus by far. To perform it, have your patient step up on a stepper by using the upper leg. This exercise can be progressed by increasing the height of the stepper and more load can be placed on the gluteus maximus by leaning forward. If you want to increase load on the gluteus medius of the stepping leg, have your patient hold on to a weight in the opposite hand. An exercise that was not evaluated, but that is our personal favorite for building strength and achieving hypertrophy of the upper and lower fibers of the gluteus maximus is the loaded hip thrust. This exercise has been shown to have a higher glute max activation compared to the back squat and deadlift in studies of Anderson in 2017 and Contreras in 2016. Ideally, it is performed on such a hip thrust device with your shoulders resting on the pads. Be careful that your spine does not extend too much, which you can prevent by looking forward during the exercise. Be aware that EMG activity is only one factor that you should take into account when designing an exercise program. So while it can be a good basis to know how well a certain muscle is targeted, you should further analyze your patient's functional needs and take other factors into account like joint angle, open and closed chain, coordinative demands, sensory motor feedback, level of irritability, and skill of your patient to select suitable exercises. A book that I personally find complex but amazing in sport-specific rehab is Strength and Coordination by Franz Bosch, which you can find a link to in the description down below. If you are curious about the 5 best exercises to target the gluteus medius, which is our most important hip stabilizer in the frontal plane, check out the video right next to me. As always, I hope you enjoyed watching this video. Feel free to give it a like if you did and hit that subscribe button before you leave. You can find us on Facebook, Instagram and Physiotutors.com for more content from our side. And this was Kai for Physiotutors. Thanks a lot for watching. Bye.